And thanks for joining us tonight. A new medical center is coming to Macon to serve people from across the state who are living with an intellectual or developmental disability. The Crisis Stabilization Diagnostic Center will offer medical care for people with disabilities for up to 90 days. Cecily Stout went to the construction site to find out more about what's coming.
This is where a new medical center in Macon will be built, and it's specifically for people with intellectual developmental disabilities. They say it will provide services and attention they can't get anywhere else.
This is a way that we can meet the individual's needs in the community.
A crisis services and diagnostic center for people with IDD is being built just beyond downtown Macon. The Department of Behavioral Health defines a developmental disability as a chronic condition that develops before a person turns 22, and it limits their ability to function mentally or physically. Tamika Woods was born with cerebral palsy. She says people with developmental disabilities deserve access to a safe space when they need help.
We need more places like that for people with intellectual disabilities instead of just throwing them in an emergency room. We need somebody to actually care and gonna take the time and be patient with them.
Woods says keeping IDD patients in a waiting room can make them uncomfortable, especially when they're trying to get medical attention.
Irritable, frustrated. They're they making certain noises that might irritate the patients, but they're just part of their disability.
Greta Odell says the new medical center has inpatient care that allows IDD patients to take their time during their recovery.
They can come in 60, 90 days, get a complete diagnostic assessment along with behavioral staff to work with them, develop accurate plans.
Mercer University's School of Medicine will have residents and students work with patients to help broaden their understanding of developmental disabilities.
Those students will be able to come in and actually learn about intellectual and developmental disabilities and the differences of treating those individuals no matter what their communication style is.
The center will have 16 beds, but none of them will have restraints. If a patient's behavior is escalating, they'll be escorted to a calming room.
We really hope that that'll kind of change the way de-escalation and coming out of a crisis looks.
In Macon, Cecily Stout, 13 WMEZ News.
The State Department of Behavioral Health is also a partner for the center. They will refer patients to the Macon location, and they said state legislators have allocated more than $10 million for the project.